There are a variety of injuries that can occur through participating in sports. Each type of injury has different causes, symptoms and treatment strategies. In this program, we'll look at different types of injuries, including skin and muscular, as well as the inflammatory response to and management of soft tissue injuries. Then we'll discuss hard tissue injuries, including the management of and how to assess these injuries. Injuries can be classified into different categories. A direct injury occurs when the body makes contact with an external object, another person, or the ground. For example, you can dislocate your finger if it's hit on the end by a ball.
Direct injury is one that might occur, such as a contusion, where when you're watching football, someone gets knocked by another footballer and they get a contact on their leg and they get a direct injury to that leg.
An indirect injury is caused by forces inside the body, such as excessive strain on the muscles and ligaments.
It may be when they strain a muscle and they're swinging through in the late phase of running and they strain that hamstring, which we see so often in football and hockey these days.
Overuse injuries occur when specific body regions are used over periods of time, particularly when the movements are repetitive and low impact.
Some of the other injuries I've had are sort of bursitis, so shin splints and inflammation of some of the ankle joints as a result of all the jumps training that I do.
A soft tissue injury is an injury to any tissue except bone and teeth. For example, it could be a muscular or skin injury.
You know, during the season you've got calluses on your hand. Starting the season even after 4 weeks, you get a whole heap of new blisters and stuff like that.
Hard tissue injuries are exclusively injuries to bone and teeth. There are a wide range of skin injuries that can occur during sports and sports training. They result from the application of force, such as scraping or friction to the outer layer of the skin. Skin abrasions occur when the surface layer of the skin is broken. Skin abrasions usually cause pain and shallow bleeding as a result of skin scraping. An example of a skin abrasion is a graze caused by falling down during a game of netball. Another skin injury is a laceration, where there is damage to the skin and to the underlying tissue, for example, a cut. Lacerations can occur in many parts of the body, including the scalp or mouth. An example of a laceration is when a boxer's eyelid is split open. Next, we have blisters, where the outer layer of skin separates due to friction, which causes a pocket of fluid or blood to form.
There are plenty of minor injuries. My hands have got plenty of blisters on them from lifting all the heavy weights.
Finally, there are calluses, which result from a build-up of dead skin caused by frequent rubbing or pressure, for example, on the ball of the foot. This is common in sports like basketball, where you are constantly changing direction. Muscular injuries occur when the muscle or ligament soft tissue in the body is damaged. When a ligament in the body is injured, it's called a sprain. Depending on the severity of the sprain, symptoms will include pain, particularly at the end of the range of the ligament, swelling and instability.
As any elite athlete, most of us have had some major injuries. I guess my biggest would be completely rupturing my anterior cruciate ligament in my knee, as well as a couple of other of the ligaments in there. And so as a case of that, I had a knee reconstruction.
A strain, on the other hand, is an injury to the muscles of the body.
So one of the main injuries in football, and particularly because of the ballistic kicking activities, would be a quadriceps strain. So one of the main kind of injury types in football is a quad strain.
There are 3 grades of strains.
Grade 1 is when you just have a tear of a few fibres in the muscle. And if that occurs, often there will be pain on stretch, but no less strength when you test that muscle for strength. There'll be mild pain, but not severe pain. If you get a grade 2 strain of that muscle, then you've got more damage of a significant number of muscle fibres. And with this, you will have a reduction in strength, and you will also get pain on stretch of that muscle. And again, grade 3 is when you get a complete tear of a muscle. And when you do this, you can feel that tear within the muscle. And often we'll use more scans in elite competition so that we can really see how many fibres of that muscle have been torn.
A contusion or bruise occurs when an athlete collides with an external object, causing local muscular damage. This can result in pain, swelling, and heat at the injury site.
And you see it very commonly in the quadriceps muscles on the thigh. What happens there is, again, we get damage of the muscle, we'll get swelling and heat. Also, things are important here are that you avoid massage of that area, you avoid heating the area, and we want to make sure that that bleeding is kept to a minimum.
When somebody gets a soft tissue injury, the body initiates an inflammatory response. The purpose of this response is to defend against harmful substances and infection, dispose of dead tissue caused by the injury, and to promote the renewal process. The inflammatory response occurs in 3 different stages. In the first stage, the acute inflammatory phase, the body will send blood to the area, and the area will become red, swollen, and warm. The tissues will expand, causing pressure on the nerves, and the area will be painful. This stage lasts for 42 to 72 hours.
Damage of the capillary allows inflammatory cells to flood out of the blood vessels into the ligamentous tissue. This brings macrophages, cells, which are there to eat away the debris, the damaged cells that have occurred due to injury. And then you get some white blood cells, which are the inflammatory cells, which are aiding in the response phase of healing.
In the next phase, the proliferation or healing phase, fibroblasts move from the blood vessels to the tissue to initiate the healing. These fibroblasts start to build the scar matrix and collagen is repaired. This phase can occur within 48 hours to 6 weeks after the injury.
During this phase, the scar tissue gradually rebuilds the ligament, and we get a thickening of that ligament.
The final phase, which usually occurs about 6 weeks after the initial injury, is called the remodelling phase. This phase can last up to 3 months, sometimes longer. During this phase, the ligament is remodelled, with increased production of scar tissue and strengthening and development of the replacement tissue.
We see this very much in tendons, where initially the tendon is much thicker, but during remodelling it gradually comes back down to its old size of tendon.
When someone gets a soft tissue injury, it is important to know how to minimise and alleviate the symptoms of that injury. The standard treatment for muscular injuries is a regime called RICE: rest, ice, compression, elevation, referral.
The really important thing to do if you're there when somebody sprains a joint is to make sure you use the RICE regime, and that is rest, ice, compression, elevation, and referral on for diagnosis. So refer that person on to your sports physiotherapist, your sports physician or sports doctor, or if you have real concern that there might be further damage there, then it's important to take them to the hospital, because if you've got a severe ankle sprain, you could also have some damage to the bone and the possibility of a fracture of that bone at the ankle.
For skin injuries, the main treatment aim is to prevent infection and minimise blood loss. To this end, it is important to clean and sterilise abrasions, lacerations and popped blisters. Bleeding may also be controlled through rest, pressure and elevation. If necessary, medical attention should be sought. Hard tissue injuries involve bones, dislocations and teeth injuries. When the bone is damaged, it is called a fracture.
Other things rowers have tended to got is rib stress fractures, and when we changed oars to bigger blades, cleaver blades they were called, and you were getting less washiness of the blade, so more grip, putting more force down through the rib cage, so they were problematic.
These fractures can be classified into different types of injuries. One type of fracture is called a complete fracture and is where the bone snaps into two or more parts.
You can have a complete fracture when you break a bone right the way through. So as you can see, this in fact model is incomplete, but we can imagine that this is a complete fracture through that bone.
An incomplete fracture is where the bone is cracked, but not completely broken into two separate pieces.
You can also have incomplete fractures, which is like in children when you get a green stick fracture and it's not a complete fracture. Or you can get fractures that don't go the whole way through a bone.
Fractures can also be simple or compound. Simple fractures are when the bone is cleanly broken without breaking through the skin. Compound fractures, on the other hand, occur where a bone breaks through the skin, causing an open wound.
I also work closely with gymnastics, and often at times we see some of the athletes falling from the apparatus. If they fall onto an outstretched hand, then it's very common that you can get a fracture either around the wrist, or it could be a fracture in the forearm as well.
Hard tissue injuries can also occur when a bone becomes displaced at a joint. Dislocations usually occur at unstable joints that allow for a wide range of movement, for example, shoulder, knee and finger joints.
It's very common in overhead type activities, and then an opponent comes in and knocks that arm backwards, and that's a very common dislocation that we see in sporting activity.
Sporting activities are also a leading cause of teeth injuries. Teeth can become injured through incurring fractures such as chips or breaks, or through partial or complete dislocation. An example of a way that teeth could be injured during sport is if an athlete were hit in the mouth. It is important to know how to manage hard tissue injuries so as to minimise further harm and encourage recovery. Immobilisation and splinting are two crucial treatment responses to hard tissue injuries.
If you have suspicion of a hard tissue injury, then it's important to immobilise that part of the body. If you have splinting available, then obviously this is very helpful and it makes the athlete much more comfortable.
Different hard tissue injuries can be immobilised in different ways.
If you've got a lower limb that is injured and you don't have any splinting available, then pad between the two legs and splint those legs together so that you immobilise the bony damage.
Some form of immobilisation and rest is important.
Following a bony injury, such as a fracture of the ankle joint, initially that person will be put in a cast and be non-weight bearing to protect the bone.
Any treatment of dislocation injuries must be done with particular care.
With a dislocation, if it goes back into position easily, then that is fine. But you should not try and relocate that joint yourself. Again, it is important to make the athlete as comfortable as possible and refer them off to hospital as quickly as possible.
For teeth injuries, if the tooth is loosened, it is important to keep that tooth in place. If the tooth has been dislodged, you need to put it back into place and splint it to the adjacent tooth using foil. If this is not possible, place the tooth in milk. You then need to seek immediate dental assistance. It is important to be able to assess an athlete's injuries so that you're able to identify how best to respond to them. If the situation may be life-threatening, you need to go through the DRABC checklist. DRABC provides a systematic routine for checking for danger, response, airways, breathing and CPR.
Danger means if they're still in any chance of being in danger, you must remove that danger away from them. Response is where you talk to that person.
Can you hear me? Squeeze your hand.
Can you hear me? What is your name? Then it's important to make sure that their airways are clear. If someone is unconscious, then they lose their gag reflex and their tongue can then block their airways, or they might be in a situation where they've caused to vomit or something else is blocking their airway. B is breathing. For breathing, we're going to look at the chest and see if the chest is moving up and down, and listen to see if we can hear them breathing.
C is for CPR. If they are not breathing, give them just 2 breaths. If the person is still not breathing, start CPR and call for an ambulance. If they are breathing, place them in the recovery position and attend to other injuries, bleeding first and then bone. If the injury is not life-threatening, the toe taps procedure can be used to provide a detailed injury assessment. Toe taps stands for talk, observe, touch, active movement, passive movement and skills. This process has a number of acronyms depending on the country you're in. For example, toe taps in Australia or sal taps in the UK, but the end result is the same.
Say someone has an injury, the first thing you do is ask them about that injury. Where is your pain? What are you feeling? What happened to give you this pain? If you get an idea of the injury and the way it happens, it leads you much more easily towards a diagnosis. After you've talked to the athlete, then observe, have a look. If they've broken their leg and it's a compound fracture, you're going to see that bone coming through the skin. If the injury isn't so bad, then you can ask them to move that leg. Are they able to move it without pain? Active movement. You don't want to initially move the leg yourself. You want to see how they can do this themselves. And if they're able to do it, you can then do some passive movements so you can overpress and feel. And if they're able to do this without too much pain, then you can test their skills and how well they're able to move, how well they're able to do their skills, so that maybe they can continue on with the sport, or no, do they need to stop immediately, come off the ground, and you start your RICER regime, as we've spoken about this earlier.
In their sporting careers, nearly all athletes will experience injuries of varying severities. Through understanding and examining the injury process, we can minimise the damage caused by injuries and recognise how to best support athletes during the recovery phase. With this knowledge, we can safely and speedily return athletes to participating in the sport that they love.